TBS News, I'm Rosine Park. New coronavirus cases in South Korea has surpassed 5,000 for a second straight day, a new all-time high, with hospitals under mounting stress from the surge in critically ill COVID patients. The Korea Disease Control and Prevention Agency reported 5,266 cases from the last 24 hours, including 24 imported from abroad. A majority of the local transmissions were from the capital region, with Seoul recording a daily record of 2,262 new infections. The number of severe patients in ICUs increased by 10 to a record high 733. Meanwhile, 47 people died of COVID, pushing the death toll past 3,700. The government said that it will speed up the administration of booster shots and secure more hospital beds over the next 4 weeks as it works to contain the spread. More than 80% of people in the country have so far been fully vaccinated against the coronavirus. Meanwhile, the country is grappling with the potential spread of Omicron in local communities after confirming its first 5 cases of the new variant. The KDCA said they include an Incheon couple who returned from a trip to Nigeria late last month and one of their acquaintances. Separately, 2 women who recently returned from Nigeria were also infected with the variant. Contact tracing and testing is underway to try and isolate other suspected patients. And in response, the government has decided to reimpose a strict screening and a mandatory 10-day quarantine for all international travelers, regardless of vaccination status. That measure begins on Friday. South Korean citizens and foreigners on long-term stay visas will be able to self-isolate at home, while foreigners on short-term stay must go to a government-designated quarantine facility. The measures will be enforced for the next 2 weeks, with the possibility of an extension based on the coronavirus situation. South Africa has recorded a sharp increase in coronavirus infections, which has doubled across the country since Monday. In the last 24 hours alone, 8,500 new cases have been recorded. Health officials there say Omicron may be fueling the surge, although it isn't clear how many of the new cases it accounts for. The BBC's Nomsa Maseko has the latest.
The Omicron variant has now become dominant in what is the beginning of the 4th wave in South Africa. There's been a sustained increase in new COVID-19 infections in many parts of the country. The health department has said the increase has been reported in 7 of the country's 9 provinces. There's also been a slight increase in hospital admissions. The National Institute for Communicable Diseases has said most of the people who've been hospitalized have not been vaccinated against coronavirus. The World Health Organization has said the new variant has now been detected in 23 countries around the world.
The WHO has issued stern warnings on the dangers of vaccination apathy as the Omicron variant pops up in more countries. WHO Chief Tedros Adhanom Ghebreyesus said globally we have a toxic mix of low vaccine coverage and very low testing. He said it's a recipe for breeding and amplifying variants. He also reminded during a briefing Wednesday that the Delta variant still accounts for almost all cases. That's all the news for now. You're listening to TBS eFM.